Thank you for the opportunity to share today. It's really an honor, and it's an honoring not only for the work that I'm going to share and some of the ideas and philosophies, but it's really an honoring of the work that you are doing in your own respective communities and nationwide, and the influences you have not only in the U.S. context, but likely internationally too, and in your hometowns, where you're practicing and conducting all the things that you're doing with a good mind and with a good effort going forward. So I appreciate everyone here and everybody that's bringing their, been here throughout the past couple of days and sharing all your knowledge. So very thankful for that. My name is Rodney Haring. I'm a member of the Seneca Nation of Indians, which is located about 30 miles south of Buffalo, New York. I live on the Cattaraugus territory of the Seneca Nation. My Onondaga or Seneca name is Hadont Deita, which translates to he keeps warm or warming by the stove. And I'm also, as mentioned, the chair for the Department of Indigenous Cancer Health, and it's the only department of Indigenous Cancer Health at any NCI-designated cancer center in the United States. I just want to give a short land and water acknowledgement. In our Haudenosaunee, or our ways, and you may have heard of us in the history books as the Iroquois or the Iroquois, but we ourselves refer to our people as the people of the Longhouse. And part of our way of understanding who we are and our relationships to ourselves, to our communities, and to the health and well-being of our people, we think of our relationships every day in what we call the Ganonyong, or the Thanksgiving address. And the Thanksgiving address is what we say these words before all else. So in the morning when we wake up, we think these words. When we go to bed, we think these words. When we practice and we work in our communities, we think these words. And I'll just share the beginning of that. And and basically what that means, and it goes on to give thanks for a number of different things, but basically what that is saying is that we are here, we're in good health, and we put our minds together as a collective to think good things and to behave and understand ourselves as a collective with all of our minds as one. We give thanks and appreciation for our life forces and our well-being for not only ourselves, but our people and our communities. So, and then we go on to talk about giving thanks to our lands, our waters, our medicine plants, the sun, the moon, all these things that create existence, that we're not separate from those things, but we're part of that. People are part of that. We're not separate. So in our way of thinking, to give thanks is to give thanks to the health and wellness of all things, which creates the health and wellness of people, and that's our Ganonyo. So we acknowledge our respective indigenous landscapes and ancestral lands and waters we come from in our areas. But many don't know that in our urban population, so even here in Chicago, there's a large American Indian, Native American, Native Hawaiian indigenous population, and three of the largest urban populations are New York City, LA, and here in Chicago. So there are a lot of indigenous peoples in our respective landscapes. So to recognize the land and water is an expression of gratitude, appreciation, a way of honoring indigenous nations and peoples, both past, present, and into the future as well. These are my disclosures. And I'm going to start off, so a lot of my work is based in indigenous philosophy and how that translates. And I'm going to share that in a context, how what we've been talking about in the past few days is important to understand our community context, our collaborations, and how we work together as people. So strength and unity is really important to the premise and how we work within the organizations and in the communities that we work in. And I give a historical context of what it means to Haudenosaunee people. And so long before there were the United States was here and Canada, there were Haudenosaunee that lived all across New York and into Pennsylvania and to southern Ontario and to Quebec. And our people ranged the entire region. But we were at war with each other. We didn't get along as tribal nations, and there were 5 original tribes. I'm from the Seneca Nation, but there was Mohawk and Oneida, Tuscarora, and a number of nations across the landscape of New York, Pennsylvania, Ontario, and Quebec. And we were so much not at peace with each other that we were just at war and we could never get along. That isn't a good way to live as a people, as a government, as an organization, as a healthcare entity, anybody, family context. and the importance that we've learned over time. And you, some of the information, I forgot I have a mic on, I can walk around. When our people were battling, we make progress, and when we don't make progress because of conflict, we have to resolve that and understand that in better ways. So as people, and you may have heard this terminology like bury the hatchet, and that really comes from our coming together as the Haudenosaunee, when we had the peacemaker in Hiawatha that came to our nations to talk about living in resolution, living in peace, and how to work together in a collaborative context, whether it be for health, whether it be for political considerations, whether it be for whatever it may be, to understand that we need to come together and work that way. So over time, our peacemaker delivered these messages about how to live in a peaceful way and to come together as a collaborative and to work together amongst each other and to understand our ways of thinking. And so one representation that we bring forward is our bundled arrow approach. So when there was a message that came out and it said, hey, if we have one arrow, they asked a warrior to come up to break this arrow, and the warrior came up and said, well, that was easy, it broke one arrow. And then they bundled 5 arrows together, and they asked the warrior to break the arrows again. And of course, the 5 arrows bundled could not break it. So when our tribes came together, our native nations came together as a Haudenosaunee, as a unit of 5 in the Confederacy of the Haudenosaunee, we were it brought a lot of strength and togetherness and collectiveness amongst all of our organizations, our peoples, and our nations. So you'll see that representation also on the back of some of the U.S. currency. You'll see the eagle of the talent of the 5 arrows, and that's a representation of the strength of the Haudenosaunee and the strength of the American people. So that's a gift that we gave some of our political considerations from the Haudenosaunee to Benjamin Franklin, and we have some of the first treaties. Our tribe has the first treaties with the United States. So you'll see some of the representation of our style of governance mimicked in some respect by the United States. And in the background of these bundled arrows, you'll see the representation of our 5 nations, our 5 original nations, with the 6 nations coming up from the Carolinas, the Tuscaroras, who later joined the Confederacy in the 1700s. And our people also span across international borders, so our Haudenosaunee people now still live in the ancestral lands in Canada, but we're the same people. And the symbol you see in the background represented those 5 original nations. The one in the middle is the Great Tree of Peace that brought all of our nations together, and we still collectively live in this mindset of working together. So my historical sharings today comes from our people, but I think our goal too is to share that out. And when we look at it in a way of a health context or an organizational context, is how do we work together to provide the best we can in our communities nationally. And I think that's the goal of our Centers of Excellence and the go-to. That is really bringing us all together today and sharing our interdisciplinary knowledges and our success stories to make resilience in the future. Another concept that we've brought to our thinking is our wampum relationships. And so our early forms of communication and agreements weren't in an email, a contract, and a DocuSign like you get today. They're wampum agreements between nations. And as Native Americans or First Nations or Indigenous people, we're not only a racial and ethnic category, we're a political classification, because we have nation to cancer center agreements, nation to nation agreements. And if you follow lacrosse, and the last weekend we played in the World Games as a nation. We're the only Haudenosaunee, are the only Indigenous people that have passports and travel and can travel on our own passports as a political entity of a nation. We played very well. We came in 3rd in the world. The Canada came in 1st, the United States, and then the Haudenosaunee, and the Haudenosaunee only lost to the United States by 1 goal. But that is a representation of our people and our governance structures, and it's based on our early contracts with the United States. But we've been taking a lot of historical knowledges and bridging them forward to understand how we can build relationships within communities. So I share that because it's about relationship building, and if you think about in today's context, Maybe it's not a wampum belt that you're doing, but maybe it's an MOU or data user agreement that you have with another organization. And keep that in mind as I begin to talk about how to create those partnerships collectively with a good mind and kind of that gnonyo or that wellness thinking in the beginning that I started sharing. So in our concept, we created the two-row wampum, and we translate that to some of our patient navigation networks. And the Haudenosaunee's two-row wampum agreement of the early 1600s between the Haudenosaunee nations and the early United States, Canadian, French governments was really about this concept of traveling down the river of life together, and that the indigenous people travel in our canoe and the non-indigenous people travel in another vessel. And we may be traveling down the same river or the same river of life, but we have to have the understanding that we are also have our own indigenous knowledges, our own indigenous intellect, our governance, our the way we look at things in life, and how we, in our case, through Indian Health Service, for example, work in a health context, and is different than off-territory, off-reservation, or off-reserve health context. And so when you put it in your framework, how are you working with other health systems in your region collectively for the wellness of the people? And that's the way we looked at our navigation system, is that we paired an indigenous navigator with a non-indigenous navigator in an adjacent rural federally qualified health center to both work parallel down this river of navigation, but to understand each other's health systems for the wellness of the community on both sides, right? Together, collectively. And much kudos and appreciation and Yahweh thank yous to the Bristol-Myers Squibb Foundation for supporting that effort in the forefront. And then additional Yahweh for Roswell Park Comprehensive Cancer Center for recognizing the work that we were doing in our communities, not to pull those navigators out, but to hardline those navigators for future generations. And so our navigator systems are hardlined into our communities and supported by our cancer center. We're very thankful for Roswell Park and Bristol-Myers Squibb for really having that vision of putting that forward. We're now entering to our fourth year of deployed navigators and working in this two-row kind of conceptual framework together. And additional kudos to our rural navigator teams and Dr. Mary Reed, who was presented yesterday about navigation and lung cancer screening and survivorship, about all these things that have really transpired. And now we're translating that model to other areas across the country as well. So we're very thankful for that. And you go through life and you think about, what has been my legacy in the work that we do? We think about that. What are we going to leave our next generation? I can honestly say that we've changed lives through our navigation system. We've brought people to screening. We've educated. We continually do that. And that's one of those things that we can walk away and say, you don't know if those little ones are language carriers, our next generation of lacrosse players, our next generation of scientists. So by providing a family context, early screening and understanding, working with our community organizations across the country and really making the impact that we're doing, we continue our way of life. So thank you. Some national American Indian Alaska Native stats. I'm not going to read through these, but it's an issue in many cultures and communities and organizations across the country. Lung cancer in particular, there are in some contexts, in some areas in the United States and regions, and there are different types of usage of tobacco products, for example. So in Alaska, the rates for lung cancer may be higher than, say, in New York, or in California, or in Chicago. So it really depends on the area you come from, and the same is true with tribes. So tribes of native nations have different challenges and issues in their respective regions, which may lead to different types of cancer health disparities. Knowing your landscape too, and First Nations, Métis, Inuit, North America strategic planning and data. And so as mentioned before, for us, it's important to understand that our work doesn't stop. When you look at a map and you're like, oh, there's the United States, and often you don't see Canada, or sometimes you don't see Hawaii down here. Sometimes on a map you don't see Alaska. So it's like we have to really be cognizant of our landscapes too. So I share that in a way that you may be working in your respective town, city, county, but also it's important to think about how that situates with other areas in your region, whether it be the state, whether it be adjacent states, or in many of our cases, the borders up into Canada or into Mexico. So for us, it's important to understand some of the lung cancer disparities too for our Haudenosaunee relatives in Canada. Because Roswell Park is situated in Buffalo, which is right on the border of Ontario, and our people live on both sides of the border. So our navigators actually have to understand the Canadian system and the American system, have to understand the Six Nations Reserve where our people live in Ontario, their health system, and our respective tribal health systems throughout New York. And each one is different because our government is different in each one of those sectors, which is challenging, but I think we as people also face the same challenges when we work with our states and our counties, and it's the same kind of concept. But we have to understand that, and we have to be present in that, and we have to understand those figures. We have to understand what the disparities are and how to address that. And I know that the previous presentation talked about data, right? And it talked about the kind of picture of landscapes through Pacific Islanders, Native Hawaiians, kind of the West Coast region. And the same is true like with our data too. To understand your landscape, you can better understand how to find interventions or screening, whatever it may be, to address the cancer health disparities. For us as Haudenosaunee, our nations were lumped in with the Indian Health Service in the Northeast Corridor. And so we know as Seneca people or as Haudenosaunee people that our cancer health disparities, lung cancer rates, are different than those that say of the Seminole of Florida because they're a completely different tribal nation. But when you look at that data in the Indian Health Service, we're all lumped together into one. So we were able to pull out mortality data for all the ancestrally related tribes of the Haudenosaunee and do a 10-year follow back to get enough data to make it statistically significant to show us some interesting things that occurred that were applicable to our cancer health disparities. And by finding that, we're better able to address those needs. And this is a little older now, but one thing that we did notice at the time was that liver cancer was an issue. I think it was over 4 times the cancer health disparity mortality rates than previously reported anywhere. So that was really important for our tribal nations to understand. And lung cancer too was one of the leading causes of death among our Haudenosaunee people. So knowing your landscape, and I shared that in an Indigenous context, but in order to make change, you have to know your landscape. You can't just be like, oh, there's a grant. Let's apply for the grant because it's telling us we need to do X, Y, Z. You have to understand your landscape, apply for the grant, or make that grant work for what the disparities are. Commercial tobacco is another one. In our way of life, tobacco is also part of our way of life because we give messages. Tobacco is really important. We're known as the tobacco-caring people. But it isn't tobacco in how it is in the westernized context of commercial tobacco. It's more of a traditional tobacco context. So whenever we talk about tobacco from an Indigenous perspective, it's more in a cultural way. And so there's differences there. But we also do know that commercial tobacco, is an issue in our communities. And through that, we have to address that through various mechanisms. One grant we have now is to indigenize and to add some of these philosophies I'm talking about into our tobacco treatment specialist program. And by adapting that programming and implementing it and offering it to the tribes in our region, we hope for better successful outcomes or organizations that work with Indigenous communities to be trained as a tobacco treatment specialist with this Haudenosaunee, an Indigenous model to work with their Indigenous community members. And I would also say that, we did talk a lot about tobacco, recreational tobacco, but I think we also have to be very cognizant of the emerging research in vaping, electronic cigarettes as well. And to keep that in our mindset too, when we go to intervene, we need to bring that out a little more. And the third one that there hasn't been any conversations on it is the use of cannabis and what that influences on lung cancer. So, I think those are two next steps to really talk about in our next sessions coming forward. And then the work that you do too is to look at not only the recreational commercial tobacco, but also cannabis and vaping and e-cigarettes. In a more macro level picture of knowing your landscape, and this is how I go about it, and I challenge you to do something similar in your region, to understand your landscape and your people and the communities that you work with. So many nyawes and thanks to Whitney and Henry, who is a member of our team, for creating this map. We presented this to the Great Plain Partners in Cancer Screening Conference in 2020. But basically, the purple shaded areas are federally recognized Native American nations in the United States. And the dots, you can read the key below, but the dots are basically the NCI designated cancer centers in the US. And so we created this to see, where are the gaps on a kind of a national scale about where NCI is covering. And are there any NCI folks in here? Okay, then I'll let loose a little bit. But it's a federal government's responsibility through treaty rights to provide health care for Indian country and for all Americans in that respect. But for Indian country in particular, because when the United States came here and people came here from all around the world, we had our indigenous people all over across the country. And the trade-off was our land for health care. And a lot of people don't know that. Like you say, Native Americans get free health care. And it's not really the case. It was a trade-off in early history that our land was in exchange for Indian health service systems. So when you look at providing cancer care, you see kind of a big gap here, right, in the areas of the Great Plains. And there's a lot of tribes in the Dakotas and that region, but no NCI designated cancer center. So NCI is failing in that context. And I always challenge NCI, when is there going to be a cancer center in the Great Plains for the tribes in that area? It's been long enough. And those are some, if you work in a rural area, those are some of the most challenging areas to work in. So I know everybody's looking at their respective landscape in their state right now, but those are the dots you need to connect with for cancer care too. If you haven't connected with your NCI designated cancer center, they're a great ally and support through the community outreach and engagement teams. And to dig a little deeper, I talked about these Indian health service zones across the United States, and this is kind of how IHS is broken up. The county data are the little red squares for Indian health service centers, and you can see in New York, and the lower part of New York is kind of where we're located on the Great Lakes, Lake Erie region, and that's our specific catchment area. But our team does work nationally and globally. We've worked as far as with the Sami of Norway, the Maori of New Zealand, the Aboriginal people of Australia, and the Native Hawaiians. And a lot of our people, Indigenous people worldwide, face many of the same lung cancer health disparity and cancer health disparity challenges. To break it down even further, those are the specific tribes in our region that we're very cognizant of. Those are the tribal nations and the native nations that we based our mortality reports on, and those are the nations that we have navigators embedded in the Indian Health Service Clinic, not-for-profits in and on the reservations or reserves, and work closely with grassroots organizations within those respective landscapes. So our outreach is important too. So we've been moving a lot of our paper-based and to digital-based and film-based. So we have a newsletter that goes out to our Indigenous people worldwide, and with a focus on our landscapes. But we've been also creating our newsletter in digital film. So we have like short films for our newsletter now. Instead of like just a print newsletter, we have interviews from our communities, interviews of the data, and we've been moving to more towards our more film-based initiative. We also have a digital repository called Native Circle, and it has all the information that we've collected over time by tribes, for tribes, whether it be a research project, a clinical project, that works with our nations. And I think a lot of organizations have this, but this is something that anybody can use. It's on our website. We also have a digital library of all the films that we've created over time for outreach and collaboration. And I encourage you to, to also look at what you've done and catalog it in that way for your respective communities as an outreach mechanism. Our latest one in regards to sharing out to our communities are health communications and dissemination videos. And these come from a series of NCI grants. And I'm also the co-director of the health communication resource, which is, Roswell Park has a team that creates commercials for our area, but the health communications resource is like a small production, health documentary style production that anybody can internally or externally hire. And two of our grants that we're currently finishing up, and then our third one we're going into, have to deal with films. And so the importance of this one was like, if I as a doctor or you as a clinician or a community outreach person create a film and you put it on your organization's website, how many people are going to look at that? Maybe like, a small amount, maybe a good amount. But our goal was to work with Indigenous influencers and film stars to really have them go through the process of, in this case, lung cancer screening, to share out to the community on their platforms to reach a lot of people. So if you look at some of the first one we did was with Gary Farmer. We're going to play a very short clip of that. And the second was with Gunadio Horn. Both of these individuals were on a recent Hulu show called Reservation Dogs or Res Dogs. And they're also community members of the Haudenosaunee. So they were very happy to be part of our project, and we were very thankful. And if you look at some of the comments, there's all your qualitative comments about how these films were interactive in our communities. But even looking at some of the likes were really interesting. Like Sterling Harjo, and you see Gary Farmer's, the gentleman there. Sterling Harjo was a producer for Reservation Dogs, and he was, you see his like on there. I was like, that's pretty powerful. He's looking at that. So I'm going to turn. We also, what we did too is we did film premieres in our communities, and we created assessment tools to look at, does this film make you think about going to screening? Is it going to change your behaviors towards screening? Do you feel immersed in the process as these actors go through this screening? And so we looked at it in that way. And then we also looked at digital trace, how many times they're shared, how many times they're liked, and that's the response that we've had around that. We created 3 films. One was per actor or influencer. One is more like a health documentary about their whole journey through the process. Still short films, like 12 to 15 minutes. And then we created 2 even shorter films for like TikTok and Instagram that are just like 30 seconds and a couple minutes. So those are the ones that the influencers selected to put on their respective websites and their social media platforms. But with the assistance of my friend John over here at IT, let's give IT a round of applause. They've been wonderful this whole time, so thank you. John is going to share one of our short videos. Thank you, John.
My name's Gary Farmer. I think this is my 49th year of performing, both in the theater, television, film, and narrative. I've always tried, to be the one who goes forward and not afraid, doing it for the right reasons. That's been my role, in a way. That's my objective, is just stay as healthy as I can in my elder years and take care of myself more than I have in my youth. Hi. I've never had any incidents or sights of cancer or feelings, but my past partners dealt with several escapades. I've just gained so much knowledge about the processes, about the potential, about the new technology that the scientists are discovering, and especially that it's specified to Native America, which is long overdue. Amongst Haudenosaunee nations, lung and bronchus cancer are the top causes of cancer death in both Canada and the USA. In the USA, lung cancer screening recommendations are for people between the ages of 50 and 80 years old. Have a 20-pack a year, smoking history, current smoker, or have quit within the last 15 years. If you have a family history of lung cancer, you should also let your provider know. You can also contact a cancer-focused patient navigator or a primary care physician at your Indian Health Services Clinic, NCI designated cancer center, or First Nations, Inuit, or Métis health programs to further discuss cancer screening and eligibility.
And that's how you make your work fun. Do things like that, to make change. His voice goes all around the world, and these are things that can translate from the things that we're doing to your workplaces. Work with influencers in your respective region. Create videos and bring them into the fold to share the message. Many of our people, all people, have had a challenge with cancer. You always see it when you're at a cancer conference. Raise your hand if somebody in your life has had cancer, or somebody you love, or that's like 100%. So many of these people here, same way. They've all had challenges. They've all had loved ones or relationships in their communities that had ties to cancer. So that's just a little something we're doing. We're going into our third film now. It's been a fun project. I'm going to leave with this, and I'm going to have a few minutes for questions afterwards. But within our Haudenosaunee ways of life and thinking, it isn't really the things that we're doing now, the discussions that we're having now, the things that you have learned, is not really about the here and now. It's really about the generation forward. It's not even about the next generation, but it's 7 generations forward. Think about that. How do the things that you're doing now, the screening initiatives, the research, the clinical practices, the surgeries, all these different things, the mindsets that you have to help the people and be with the people, the collective mindset to work together, how is that influencing 7 generations forward? So when we create projects, we have both that mindset of a collective wellness, of working with the people with a good mind, meaning working towards peace, towards strength. The mindset of having, like when you see children play, the innocence and the beauty within a child, and how do you capture that and bring that into peace and wellness and strength? That's the kind of movement that we want to have when we build our projects, when we work with our communities, when we're doing navigation, when we're in clinical practice. Those are the things that we want to braid together in our wellness and things that we do. And how do we braid that together and think 7 generations forward? That's how we do it. And so we share that message with people too. And these are my 2 young ones. They're a little older now. But that's when we look at that, I have them sitting behind me in my office. So I know that's a good reminder that that's our duty. And it's our responsibility. It's a responsibility that we have, but it was given to us by our parents, by our grandparents, our ancestors. And now it's our turn. It's our turn to take charge of that responsibility and move it and think forward 7 generations. A few recommendations. Center of Excellence. If you don't have in your payee networks a classification for Indian Health Services, please add that. That's like you have your insurance carriers, and some organizations don't have even a tribal designation in their systems. I know that we're there in your landscape wherever you work. So if there's an Indian Health Service unit in your area or region, connect with them, or a Native Urban Center, connect with them. So this is one recommendation that I would say. We're not a payee either, or a payer of last resort, but it's a federal fund that comes to Indian Health Services and should be in your network system for payee. Formalize a strategic plan to work with tribes and Indigenous urban centers. If you haven't had the opportunity, we've been asked this question a few times while I've been here, how do we make that connection? Go to tribal leadership, make an appointment with the health director, go to the human resources that if there's gaming or other enterprises in your region, go to the human resources and ask to be part of the health fair, for example. So those are all strategic approaches to working in Indian country, but beyond Indian country, within populations that you want to serve but haven't been made a headway in there. Talk with the organizations that many of their employees work at from that respective community. Implement a strong outreach and engagement plan. Hire people from the communities that you're working in. I think that's key. I know, like, I think Russell Park was in 1868 the first cancer center in the United States, and there weren't too many Native Americans working there. I'm like, well, it's been here a long time. There's all kinds of tribes here, but we can say that we've changed that. We're the first Department of Indigenous Cancer Health, and we have a strong team of 15 and growing. So we're very proud of that, and they're from all the nations in our region. Building MOUs or data user agreements, if you're into research, with partners. For us, it's tribes, but it could be with organizations, it can be with communities to understand the needs of the communities and build MOUs for stronger partnerships. And so those are all very important. With that, there's some of our team, and I'm very thankful. I'm happy to answer any questions. Nyawe.